We're preparing our meeting. One, two, three. We are already live. We're preparing our meeting. Good evening, everyone. Muy buenas tardes para todos. How are we doing? We back again. Thursday, October 16th. We are back as we promised last week. We was going to be back. So today we have a different live. It's going to be a different conversation that we're going to be talking about today, but highly important. So it doesn't matter what is your age, it doesn't matter your ethnicity. If you live in the US, this is a topic that you should sit down and listen to, because aside from information, then you're going to get educated either for now or future references. Um, what is the conversation today? We're going to be speaking about open enrollment 2025/2026. So as you know, it's October 16. Open enrollment started yesterday for Medicaid and Medicare. So for those that are over age of 65, there's open enrollment right now for you to go to the market, for you to compare plans, or if you're going to change any information, change health plan. This is the month to start off to do those changes that you want to do. So this is the voice of Hablando con Belili. We are here on Thursdays exchanging information, bringing information to you guys, and bringing life. So with that said, I do have a great agent with us tonight, an agent with an experience, an agent that speaks various languages, an agent that is willing to connect with you. So with that said, I will present Agent Karina Portes. How are you, Karina?
Hello, hello. Thank you. Good evening, everybody. Thank you so much for having me tonight. It's definitely a pleasure to be out here. Yes, it is AUP, and I hope everybody's ready. And like you said, it is for all ages because we do want to know what it is, even for our parents, right? So if you're younger, you want to hear our conversation today, definitely. My name is Karina Portes. I am a licensed life and health insurance agent. I help individuals and family find the right coverage to help protect their family, their health, and the future. So I'm very happy to be here. I think we're going to go over Medicare and what it is and where I come in that topic, right?
Absolutely,
I'm
absolutely.
happy
It
to
is an
be here.
exciting It is an exciting month. It's October. The leaves and the weather is changing, and it's beautiful out there. You know, it's not cold. There's still a lot of people out there, and I could see the excitement of a lot of organizations out there. People are just excited about this month for the simple fact that it's open enrollment. So, talk to us, Karina. What is an open enrollment?
Well, what AEP stands for, it's annual enrollment period, right? So this is where everyone can check their benefits again and see as a Medicare recipient, right? So if you're a Medicare recipient, later we'll go on and say what Medicare is, correct, Leni? So we'll go over what it is and who's eligible and how does it fit your life, right? So what Medicare Advantage that you have today, this is where you check your benefits. This is where you go and compare what you have. This is where all the plans have already adjusted with the government. They negotiated with the government what they have and what they can provide you as a Medicare recipient. And this is where you choose one. Who's in the network, what doctors you want to see, the specialists, your medicine. So everything's very important now. So it's open from October 15th to December 7th.
Absolutely. So it's going to be busy months, right?
Yes, yes, it will be a busy month. And what Medicare basically, not basically, it's very important that everybody knows it's important because it provides affordable health coverage for people age over 65 and older, and for some younger people with disabilities. So if you're disabled and you're more than 2 years, then you're probably eligible for Medicare. Of course, having all the requirements from the government, having worked here a certain amount, and all, being a U.S. citizen, or naturalized citizen. It helps pay doctor visits, hospital care, prescription drugs, and other essential health plans, protecting people from high medical costs at that age, because remember when we were 65, we're not working as we are now. So, of course, the government, if you have worked here, the amount of years required to acquire this Medicare, then you are entitled to your Medicare. Part A for hospital and Part B for doctors. Mhm.
Absolutely. And then I just want to emphasize, Karina, I speak Spanish also, hablas español.
Sí, hablo español también, así que si tienen alguna pregunta, si quieren comparar su plan de seguro que tengan ahora, por favor, se comunican conmigo y otra vez me voy a introducir en español. Mi nombre es Karina Portes, soy representante de Medicare Advantage aquí en el estado de Nueva York. Am, y aquí estamos explicando qué es Medicare y quién es elegible para el Medicare, ¿verdad? Medicare ah, le da un seguro médico a personas con 65 años o mayor y personas con discapacidad. Claro, tiene que ver mucho con el hecho de que hayan trabajado la cantidad de tiempo que deben de trabajar para realmente tener este seguro. ¿Y por qué es importante? Porque te ayuda a pagar los costos de hospital, de médico, una vez que ya estamos retirados.
Absolutamente. Como Karina lo explicó, eh, ella habla inglés y español, so para los que están interesados en cualquier tipo de información sobre plática que vamos a tener esta noche, por favor no pierdan cuidado de escribir a Hablando con Belly y luego también vamos a poner la información de la gente por test para que ustedes puedan comunicarse con ella por cualquier tipo de información. Como lo dijo anteriormente, no tiene que ser una persona ya de tercera edad. Cualquier pregunta que ustedes tengan, por favor, háganla. O en estos momentos ustedes pueden mandar sus preguntas porque ella está aquí para representar lo que es el Medicare en estos momentos. Así que no pierdan cuidado. So, Karina, we're just going to jump in. So tell us about this, we already spoken about the open enrollment. So let's jump into the plans.
Okay. Well, the plans in reality, we like to sit with each client to see which is eligible, right? So what changes in the plan? That's one thing, right? What's different? Like, aren't they just all cookie cutter? They're all the same. Maybe X company has six different plans, and you want to know what's best for you and what is best. How do you weigh it, right? What's best? Well, you want to make sure that your doctor is in the network. You want to make sure, I mean, there's a lot of things, right? And one of the things that I hear a lot in our Spanish community is something that I'll say later. But for now, we want to focus on the network, your PCP, your specialist. You have a cardiologist. You want to make sure is in network for next year, right? So you want to check that out. You want to make sure, go back to see. Right now, you should have received the new summary of benefits from the company that you're with now. So most likely you've already have that. So now you're gonna check um, the eyeglasses. Some have acupuncture. Others have dentists. Most of them have dentists, which is why important to have a Medicare Advantage, right? So doctor visits, these are all things that are Medicare Advantage, which is Part C that we didn't discuss. So we have A for hospital, B for doctors, and C is Medicare Advantage, where I come in, right? So I have different companies such as, and I'll name a few just so you know what I do. Well, like Health First, United, Emblem, Anthem, they all have different Medicare advantages, and we can all sit. We have MVP, so it depends on which one fits your needs. And most importantly, like I said, and I want to reiterate that because it's really important that your doctor, your specialist, right? That you don't want to change your doctor, then you don't have to. You can always change your Medicare plan, and this is the time to do it, right? So it's very important that you know that.
Right.
And mhm.
Yes, absolutely. We do want to emphasize that that is open enrollment. So if someone wants to check out all the plans, probably, you belong to X company and you want to check out other plans, this is the open window to do it, right?
Correct. Yes, you do have October 15th till December 7th. And I'll say this in Spanish too, Bellini. So, quiero decirle a todos mis futuros clientes, espero que sí, que todo lo puedas ayudar con sus necesidades de Medicare Advantage, que es muy importante que sepan lo que tienen ahora. ¿Qué plan tienen en este momento para que comparen? Ya para este tiempo deben de tener el Summary of Benefits de la compañía que ya tienen y asegurarse que su doctor siga en la red. Su especialista, muy importante, ¿verdad? Que le cubra sus lentes, si tiene acupuntura, si eso es lo que desea, dentista, los viajes al doctor, que son muy importantes, entre muchos, ¿verdad? Y muy famosamente la OTC, ¿verdad? Over the Counter Benefits que yo le digo a mi comunidad latina que es muy, sí, son buenísimos, porque ahora estamos 65, estamos en un ingreso ya que está estable, o sea, y es muy bueno tener ese ingreso adicional, pero es más importante tener tu doctor en la red. Y siempre le digo eso, que prefiero no ese extra dinero, pero su doctor en la red, que es muy importante. Así que siempre tienen que ver eso y ponerle énfasis e importancia a lo que realmente importa, ¿verdad? La salud.
Absolutely. So,
Ujú.
Karina, who qualifies for these programs? We know they are governmental. We know that you have to be, or you don't really have to be to a certain age because there's certain criteria. However, if someone is 64 and a half right now and they don't really know where to go or what to do, you know, what would you tell that person?
Well, if that person have worked the amount of quarters necessary, which are 10 in the United States, they are able to apply for their Medicare and their Social Security, right? So it goes hand in hand. Some people do go on Social Security and not really need the insurance because they're still working, or vice versa, right? So, what is necessary? It's having worked the amount of time in the United States, right? Having the enough quarters to be able to be eligible for this program. So this is very important for our Latino communities, right? So it's important to know that, yes, sometimes people work and they don't maybe, they're not doing their taxes and they're just, oh no, I don't want to do my tax. Not important. Yes, it is. It's very important because once you come to an age that you're going to need health insurance. And guess what? You don't have the energy to work and do the things that we do now, right? So you want to make sure you're covered. And so how are you eligible for Medicare Advantage? I believe you asked, right? So what makes you eligible for Medicare Advantages? Well, you first have to have A, which is hospital care, like I said, and B, part A's and B's. And that would make you eligible for Medicare Advantage and all the benefits that I mentioned, whether it's the eyeglasses, dentists. I mean, they each give you an allowance to be able to see these doctors, specialists, right? And the trips to the doctor, the OTC, which a lot of them have, not to say all of them because you can see this in any state, and you want to know that every state does have different rules on how they come about with their OTC.
So as of now, what are the states that you practice?
Right now, I am focused in New York, but I do practice in Texas. So Texas and New York for now.
Wow, awesome. So to all of you guys that are watching or are going to see this video later on, contact Agent Karina. She's here. She speaks our language. So you can go wrong, contact. Give us your phone number.
Oh, yes, of course. You can contact me at 929-366-8578. I'll repeat that, or you can put that on the live, right, Bellini?
It's, what I'll do, I'm going to write it down. We spoke about open enrollment. We spoke about what is Medicare. And I think we have not really spoke about because sometimes I find like people get confused what is Medicaid and what is Medicare,
Excellent.
right?
So it is what you say it and we're saying it, right? Medicare. So they care, the care, right? They care for us because now we're older. And Medicaid, it's an aid from the government, right? So that's the difference. So Medicaid, it's well, as you can see, this is Medicare. It comes in three different colors, and you get this after you retire, right? Or disable for more than 2 years. And Medicaid, it's usually depending again on what state, but this is federal. So this is always this. This is, United States. It's always like this. The Medicaid, which is an aid from the government, and that regards with your income. So it depends on if you're married, if you're single, what kind of income it's coming in. And so if you are eligible, it really depends on the income that you're bringing in every year. So you can always try. Your agent should be able to help you with that. If they ever ask you, if you're sitting with an agent, if it's not me, and they ask you, how much are you making, no, how much the Social Security gives you every month. So the reason they're asking is because they want to know if you qualify for Medicare. It's important to know, right? Because if you don't qualify, or if you do qualify, right? If you do qualify, and you're not receiving it, you might be paying $185 for Part B. And that could be they can actually the government can actually help you with that, which is, Medicare savings program. So they can help you with different things, and you want to make sure that you are in the right plan, your income, everything. These are little details that the reason, and my goal for 2025 here for AEP is help as many people as I can. But again, I'm going to limit myself for no more than 5 people a day, just because I want to give that service to each of one of my clients. Like, I want to make sure that I look up their doctors at network. I want to make sure that their their bless you, their specialist is in network. We want to make sure that if they are eligible for Medicare, Medicaid, we can do that for them too. And I just want to do the whole thing. I want to be the go-to. Salud. So yeah,
Oh,
so I want to make sure that everybody's, nicely covered. And I'll say this in Spanish too. So mi meta para el 2025, octubre 15 a diciembre 7, es poder ayudar todas las personas posibles que tengan su Medicare, ya que ya han sido elegibles por el gobierno, ya sea por su edad, ya sea por una discapacidad, que tengan más de 2 años. O por tanto, por lo que sea, yo quiero estar ahí para ello, para hacer su parte C, ¿verdad? El Medicare Advantage Plan. Y me encantaría poder ayudarlo y asegurarme que está en un plan correcto.
definitivamente, definitely. So, um, I have a question here that someone asked. If I am already in my 65 and plus, and I'm still working and have my primary insurance through my job, can I still participate on Medicaid or Medicare?
Oh, sorry. If she's still paying insurance with her company, she has credible insurance. So she's, what you compare now is, are you, are you going to pay less with Medicare with Part B? Are you eligible for a Medicare savings program? Are you eligible for the government to pay you the 185? You want to compare how much. This is where you say, okay, wait, I already have insurance from my previous company. She's retired, she said.
I'm not retired.
She's not retired, and she's 65,
67.
67. She can still get her Medicare. If she has to compare, if paying 185 a month to have Part B, so she'll be eligible for Part C, then it depends on how much she's paying in her insurance now. So it's how much, how much is she paying for her employment plan.
So
So
this,
usually those group insurance are very well, financially they're not as much as 185 a month, and they're probably a PPO. So
so the key right now, especially during this month, the market is open, so it's best for people to go, check things out, double check what they have, or et cetera, et cetera, et cetera, right?
Absolutely. This is the time where you check because even that person that is asking that question, you want to know this is open enrollment, right? So you won't get penalized because you didn't enroll for Medicare because you have credible insurance. So that's good. So, but now what you say, okay, well, I'm paying $250 for to have this insurance every month with my company. Would it be more economically smart to just get on Medicare? You can still work. You can still work, but now it's going to go down to 185. And then if you have part A and B, you get all the benefits because some people even have two insurances, like for eyeglasses and and one for to see doctors. So now, if just you have to compare. That's why I like to sit with you. We'll say, okay, wait, Miss So and so, how much are you paying every month with your employer's plan? Oh, well, I think it's a little high. Let's compare. If you pay Part B, you're gonna get A and B because A is a given because you will get A, but B, you have to pay that premium, which is 185 going up 2026. Not much, but I believe it's a certain percent. Um, but then you get a Medicare Advantage where that's where I come in. Now you get eyeglasses, acupuncture, depending on what plan, right? Not everybody has acupuncture, but depending, we'll see which one's better. It's not cookie cutter, it's everybody's different. All the companies are different, but you do have dentists, you have trips to the doctors if you don't want to drive. So this is where you compare. This is the time.
That is interesting because someone asked, what does Medicare covers? So you literally just answered the question.
Oh, perfect. Thank you. Yeah,
Absolutely.
so Medicare, yeah, hospital doctors, and C, which is all the other, and of course, Part D, which is the prescription drugs, right? It does cover the prescription drugs to a certain amount. I mean, some people have little deductibles that are up to every plan is different, but we can sit with each person.
So I do have another question here. I don't qualify for Medicaid. However, can I pay into my Medicare?
Interesting. You could do that, but it depends how much. Again, we're going financial now, right? Um, is it really gonna save you more? You paying into because she wants to have Medicaid, right? I think with a Medicare Advantage, again, every situation is different. So I don't like to just one broad question, but sometimes financially it doesn't make sense. For I have my aunt, and we tried to do that when she wasn't eligible for Medicaid. So what we did, we tried to find out, okay, so how much do we have to pay into? It wasn't financially smart. It was like, well, you're better off just paying. At that time, it was 171 that she was paying for Medicare Part B and getting your Medicare, Medicare Advantage.
Wow, absolutely.
Yeah. Mm.
But holistically, right? We do know that depending your income, you may qualify for the whole package, or you may not qualify for the Medicaid or the Medicare, correct? So if someone don't qualify for Medicare, they stay with only with Medicaid. So what are the advantage that they could that they have or they entitled to?
Just from it. Well, if you've worked here and you're legal citizen or naturalized citizen, and you've worked the amount of time that you're necessary to work here in order to get Medicare, that goes along with I mean, you don't have to apply for it, but it goes along with your Social Security income that's going to come later. So it's not like, oh, I'm not going to get, why wouldn't you get it? Like, for the most part, it's just going to give you more benefits.
Absolutely. So we do encourage the entire community, be engaged, be informed more than anything else.
Inform, and not just, yeah, there's different, everybody's out there. It's a zoo. And, you just want to make sure you sit down with the person that actually cares. And like you already know me, Bellini, you know that I do it for, honestly, like I have my mom, my dad, my aunt, like I have so many people, and I want to make sure that you save that buck at the end of the day, that you're well covered, and that's the most important thing. I mean, for me, it's not having 10 people a day. For me, it's not that. For me, it's actually, it's caring and making sure that your pockets are taken care of because now we're in a limit budget, right? And a limit income. Sorry.
So let's talk about what happens after January 1st, because we know right now the open enrollment, you could go to
Mhm.
market, um, you could, compare, you could enroll. So when January comes, what is the next step after that?
Well, all the plans will be active as of January 1st, so you get to try, right? You get to try any plan that you chose. So you chose yours, so it's December 7th, annual enrollment is over, you're done. December 1st comes along, you get to try. You get to make appointments, see how hard or not hard, how much you like it, what's covered and what's really not. You get to try. You get to try your Medicare Advantage now. So this is important, right? So because you get another chance to change one more time, and that's it. And then you're locked in. So it's really important that you make your appointments and make sure you like it. You make sure the benefits that you have, and all the perks. Because at the end of the day, they're perks. If you get driven, to the doctor back and forth, it's things that we want. I mean, I'm sure I want, especially. I mean, I want them now. So imagine later. So I definitely want them. So yeah, you have to really check, and yeah, you have one opportunity, and then that's it. You're locked until you got to see me again in October 15, 2026. So you want to make sure. Yes. I mean, there's different rules to the game. There's people like that are eligible for Medicare, and they may be able to change once more, but for the most, it's like you're locked in.
So just be mindful that once you're locked in, you are locked
Mhm.
in, and you wait 10 months, 9 months, 10 months
Yes.
to
Yes. Make
re-enroll
sure.
them. And make sure whoever you sign up with, you do your homework diligently, right? If it's someone that is new to this, make sure you do your homework. If you don't speak the language, please find someone or family
Yes.
member. If you're not well educated in this area, have a family member that is going to advocate for you.
Absolutely. That's so important also. You just said something so important because I sat in so many living rooms and it hasn't been with one person. Even though one person's eligible and I'm signing up one person, it is the whole family. Like their son is there. Oh, wait, I gotta call my daughter to make sure this doctor and people that are understanding of the fact that I want my specialist in the network. I don't want to stop seeing my PCP. Easy's still going to be there next year. Or who else is going to give me that perk? Who else is going to be, what company is going to make sure that he's going to be in that work? And who has the best customer service? That's so important too. Like you want to call that company and be able to get your taxis right away, that transportation. So it's a lot. You want to make sure of so many things. So, if it's not you and you don't know and you can't understand and you don't want to, it's fine, but have somebody that cares right there next to you asking questions.
Absolutely. And the language is highly important to connect with someone that speaks your language.
Absolutely. Yes, the language barrier is very important. You have to, um, yeah, it's very, 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 very
Anything else
important.
that you want to share with us?
Well, I think we want to go back a little bit in Spanish because I think we missed out a little bit in saying after the OTC, I believe that we spoke about,
Yes.
right? So, voy a hablar un poquito de español ahora sobre el tema de Medicare Advantage y quién es elegible, ¿verdad? ¿Quién es elegible? Las personas que tengan 65 y están retirados legalmente en este país están calificados para recibir su Medicare. Medicare usualmente la parte A se la dan y la parte B tiene una prima mensual de $185, un poquito más para el año que viene, pero usualmente tiene una prima. Y es muy importante saberlo porque algunas personas sí califican para, por ejemplo, Medicaid, Medicare, y no tienen Medicaid por cualquier razón. Así que le digo otra vez, lo digo ahora en español, ¿verdad? Que es muy importante sentarse con un agente que le importe, que averigüe, que chequee. Si le preguntan cuánto le está dando Seguro Social mensual, usted se asegura es para ello asegurarse de que si califican o no. ¿verdad? Para Medicaid, el aid que es de gobierno, ¿verdad? Que lo va a ayudar a pagar esos 180 y pico de dólares mensual y no le va a costar adicionar su medicamento. Y bueno, es muy importante y así yo creo que dije que mi meta es ayudar a sentarme en muchas salas, sentarnos a averiguar cuál es el mejor plan.
Definitivamente, creo que para la comunidad de habla hispana hemos hablado claro, pero en un momento que ustedes tengan cualquier tipo de pregunta sobre este tema de hoy, tenemos a la gente, Karina Portes, que ella les va a atender. Solo les dicen, te vi en el programa de Hablando con Belly, necesitamos tu asistencia. Ella cubre el área de Nueva York, New York State, lo cual que ella es ambulante. Si quieren una cita en teléfono, si quieren una cita de face to face, uno con uno, pues ella está disponible para darle servicio por teléfono, una entrevista, una explicación. Ella está para servirles aquí en nuestra comunidad.
Claro que sí, muy felizmente le ayudo. Igual como dije en inglés, es muy importante que entiendan el tema del Medicare, porque al final del día los biles, ¿verdad? Las facturas le llegan a usted, ¿verdad? Y me he sentado en muchas salas donde lamentablemente han tenido el plan equivocado y pues le han llegado muchas facturas. Y no creo que es justo de cuando uno llega a cierta edad o está discapacitado, de que uno tenga que pagar algo que realmente tal vez no debió de pagar o de deber en primer lugar. Así que es muy importante. Si no lo entienden ustedes, pues buscan una persona que pueda hacer la pregunta que ustedes no puedan hacer o que no entiendan hacer y no le importa entender, pues está bien, pero busquen un hijo, una sobrina, alguien que le ayude a guiarlo a este proceso.
Y también queremos enfatizar especialmente a la comunidad latina, eh, personas que han trabajado a lo mejor 20, 30 años y desconocen que esto existe porque se han visto casos de gentes que ya tienen hasta 70 años todavía trabajando porque desconocen que hay un programa donde ellos a esa edad o desde los 64 y medio que ya deberían de estar adiestrados. ¿Qué es lo que va a pasar cuando llegan ya a los 65 años? Que hay otros servicios que les pueda servir.
Wow. Muy importante dijiste eso, porque también me he visto muchos casos así, que gracias a Dios, ¿verdad? Tenemos el ánimo y hemos estado bien saludables como comunidad y partícipes del mundo, ¿verdad? La persona está más saludable, más educada, come mejor, va a ejercicio, entonces quiere decir que tú llegas a los 65 y ni cuenta te da y pasan más años y tú luego ni siquiera sabes que tienes este beneficio, cuando realmente lo puedes tener, aunque sigas trabajando. Muy importante.
Y es un beneficio que no es gratuito, es un beneficio que tú has trabajado a lo mejor más de 40 50 años, que tú has sudado la saliva más gorda de tu vida, el sudor más gordo
Sí,
de tu vida.
así es.
Tú has dejado tu juventud en un trabajo y vienes ya a tu edad de que ya deberías de, ¿no? de tener los servicios porque la salud es vida y es muy
Salud
importante
es
tener un
vida.
salud médico.
Así mismo, wow. Muy importante. Qué bueno que dijiste eso y mencionaste eso, porque en particular me tocó un caso así muy triste, porque la persona ni siquiera sabía que era elegible. Igual como agente, como eh, me importa, ¿verdad? Como el hecho de que cada persona que yo me siente y chequee los beneficios que deben de tener. Yo en este caso me senté con este señor y bueno, aplicamos para el Seguro Social. Eh, Tomó un poquito de tiempo, estaban haciendo construcción en una de las oficinas que nos quedaba cerca en ese momento. Creo que tú sabes de quién te estoy hablando. Y le hice el proceso completamente y bueno, gracias a Dios, creo que sigue yendo bien y tiene su plan médico. Por lo menos tiene su Medicare que realmente ni siquiera él sabía que lo tenía.
Absolutely. And it's highly important, to remember that once you start off this process, especially you are transitioning from your young age to the golden age, 4 and a half. It's not overnight. So that's why, they encourage people at least for you to start off your process at least 3 months before your 65th birthday, because it takes, process. There's people that have applied probably 3 months before their birthday and they end up getting services until a year later,
Yeah.
right? Because it's not just the process that you're just gonna go in. No, it is a governmental process. So that's why we encourage people. If you're 64 right now, start off, get informed.
Yes, get informed. You can visit the website, the Medicare.gov, and they have tons of information, tons, and I believe it's in different languages, so they'll be able to reach out. So pueden chequear la página del gobierno, medicare.gov, gov, y ahí le tienen un montón de información sobre el Medicare, quién es elegible y toda la información que hablamos aquí. Pero igual me pueden llamar a mí al 929-366-8578 y puedo, bueno, nos sentamos a chequear qué tienen, para qué califica, si necesitan firmarse para llenar su Medicare. ah, Así que estamos a la orden 100%.
Exacto. And it's highly important to create a relationship with your agent.
Yeah, it's
Highly
very,
important for you to create that relationship, get to know your agent. Pick someone that is reliable, that whenever you need some assistance or you make a call, you being, served, you being respond. Any questions, that is highly important in this industry for you to create that relationship with your agent. Some of the agents you become like a family member.
it does. Yeah, it's true. That's how it is. I mean, I've sat in many tables to eat. Family members, so yeah, definitely. All the way from Texas to New York. And yeah, it's a community, and it takes a community to even, understand Medicare. I learn every day. Every single day you learn.
Absolutely,
So
absolutely.
it's
Because
important.
it's a different industry. I guess, when you're not at that age, you don't even think about, okay, what is the next step for me when I get to my golden days? Because oftentimes we don't even think about the age, but the age is here, you know.
I know, we don't.
Exactly.
We don't, but yeah, like you said, it is here, and we should be very happy we got here because we've worked for it. So
Absolutely.
now, you know what? Let's get it. Let's get it back.
Absolutely, absolutely. Get on the game. The market is open. We do have Karina here today present. She already, spoke to us in Spanish and English. She already narrated a little bit about, what's taking place right now. It's open enrollment. So it's time to go to the market and check things out. And I bet there's new plans out there. I think there's even new organizations out there
Mhm.
that are helping out. But today we do have Karina here. So if you want to get in touch with Karina, give us your phone number or where to find you.
Yes. 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 Thank you so much for having this. And again, I can't emphasize enough. Always know who you're sitting with and make sure they have the correct plan. It's not all cookie cutter. My phone number is 929-366-8578. Leave me a message if I don't answer. It's a very busy season now, but I will definitely call you back and sit down with you and your family members and help you choose what's best for you.
And then we do encourage to, especially for the elderly out there,
Absolutely.
sit down face to face with someone so you will get the vibe, you will connect with that person. Although, it could be done over the phone, but what do you think? It's best for people to get to know who they talking to, who they giving the information to.
Yeah, I mean, it's up to them. I mean, they've met me here. They can go into my Facebook too. I do have an Instagram, which is Karina, your agent. Um, and you can get me at the Medicare Hub. So I'm there as well. Um, if they feel comfortable, we can even do something like this, which is, very personalized already. We can see each other if they want it, but we can also do in person. That's why, I save that amount of people that I want to see a day because I always leave room to actually go and see the person. So, but if they feel comfortable on the phone, by all means, yeah.
Are you excited for
I'm
this moment?
excited for the annual. Yeah, absolutely. I'm excited. Yeah, just knowing, just it's been a whole process to get here and seeing all the different plans and you know, how the government and they work out their plans and, you know, what they come with, you know, what they come out with. I mean, I have three very important people in Medicare, so it's like, oh, wait a second, you know, so I'm checking for them first and seeing firsthand if they're in the right plan. So I'm super excited. I think this is a point of life that everybody should be excited about because 65 is not like before.
No.
And
Oh no. Oh no.
it is not like before. We like 65 today is honestly like I don't want to give a number, but it's not like before. I mean, I remember my grandparents being 60. I don't even think they even made it to
Yes.
65. Like it was sad. People didn't really take care of themselves. And so seeing this, like this era that, you know, 65, you still can get your Medicare, still work. You know
Yeah.
how many perks you have now? You should be proud. Like I'll be like, when I have my, I'm like, yes, I want my Medicare Advantage. I want all the perks. I want the car to come and get me. Like, you know, so
Yeah.
I'm happy to assist everybody, especially you know, I want to make sure that they know their medication can be, you know, if you don't feel well, your medication, the right doctor, your PCP is so important. The communication, you know, making sure that you don't have to change doctors because of the network. It's not, no. If you want your if you don't like your doctor, now we go back, right? If you don't, then you know what? Let's search for a good doctor that, you know, that not me personally, I can't recommend, but I'll see what's out there and see, you know, let's see who's there and what are the recommendations of this particular doctor. So it's important. And that's how we last this long. Like that's how we're gonna stay young and healthy.
Exactly. And the living span is being prolonged now.
Oh
Like
yeah.
earlier, back then I believe people didn't even live to the 40 something or 40th, you know?
I
But now
know.
we're living in up to our hundreds. We're now in our 50s, 60s.
Yes. It's
Like you'll be like, how old are you again?
Yeah, exactly. Like I've sat with people that I'm like, is it what your mom? Like I'm not understanding. And it's like the mom and the daughter, like everybody's on Medicare. I'm like, yeah, well, okay, but it's awesome. It's just an awesome era.
Yeah.
And we have to all, you know, choose the right people that are gonna keep you healthy and beautiful. And
And
so
it
we
is
can go.
amazing time. Like you mentioned, it to me, seeing this phenomenon happening, in terms of people living long
Oh,
and
yeah.
information that we have out there to be healthier is even better because you no longer have to pay for education. There's so many sources out there where you could just pick a topic and educate yourself and be better every day. So that's why I'm loving these great moments. Um, and I have made up my mind, whatever is taking place, it could be negative. I just see it. Okay, I'm just gonna play with it because everything is well right now.
Mm.
Especially for us women, we have come along, and
Oh yeah.
we're not longer existing. We are thriving. We're living. We're showing up for ourselves. Look at us here today.
I know, I
Not
know.
in a million
Amen
years
to
I would
that.
thought of, I would have a platform and bring in women's, and men from different walks of life and speak about different topics.
Absolutely, yeah. This is awesome. You know, this era, I'm just happy. I think we're all happy to be alive in this era. It is so much going on. And of course, we have, like you said, you know, bad and good, you know, good and bad. But, you know, let's focus on the good for a change and know that, you know, we're just happy to be here, happy to be healthier. Yeah, happy to have these kind of plans, you know, Medicare Advantage that helps you be healthier because that OTC, you know, it's over the counter, but it's also a healthy food card, you know, that's gonna bring you more, you know, healthy food so our seniors can eat, you know. And so it's very
Yeah, I
important
think
to look at your benefits.
the OTC, I think is more famous than the plans because everybody asking, oh, the OT, even young people, well, do you have the OTC? Like, they really, up to it because they know that's another savings that they could have, especially today's day, with the market that is, up and down. You get $150 where you could just go to the stores and even the products have changed. So I think it's a good thing.
Absolutely. It's a great thing. The fitness, remember that? The silver
Yes.
sneakers. So it's a lot. Like, yeah, I'm just excited. I just like I'm telling you, every time I sat down with people, I just, having them use everything that's really there, not just have it, make sure you use it. Like if you have an allowance for $1,500 or whatever it is, use it. It's yours. You've paid for it. So make sure you use it at the max. If you have a gym membership, use it. It's yours. You've already paid for it. It's the cars, like I can't get it enough because I don't like to drive, but having, somebody bring you to the doctor and pick you up, use it.
Go
It's
to
yours. You've already
bingo. I heard people go to bingos. Even if you have some festive like a wedding, you could have your amulet to bring you. It's like a
Well,
car
for most of
service.
them, it's doctor's appointments, but just having that it's just really priceless.
Absolutely. And
This
and
is
what's
a
good about the car services too, that you no longer have to get stuck with a provider probably in your community. If you have someone, someplace else, there's a transportation that is going to bring you and, vice versa.
absolutely, that's a great point there. Yeah, because if you're X, Y, and Z neighborhood and you might not like the doctors there, but well, you're not stuck to them.
I
Let's look it up.
yeah.
Let's look at who a doctor you like.
I heard this lady one day, she was like, well, I do go to Montefiore to get, I think it was the dentist that she goes to. She said, I live an hour away, but you know what? When I get on that taxi, to me, I'm going on vacation. And
Wow.
that's how she said, I go on a vacation. And not only that, my driver, he waits for me. And then I was just like, wow, he waits for me. So I feel like a queen those days when I have to go because I'm going
That's
on
right.
vacation with a driver.
Queen, and that's why you are, honey, because you worked for this. So this is how they negotiate the plans for us. And I think it's amazing that, oh, that's great to hear. And it might be their only outing.
Absolutely,
It might
absolutely,
be their only outing because, for some that are already, on the older, perhaps homebound, it's their only outing. And you know what? You have to use them. You have to use every single perk that these plans give you.
absolutamente. So, esta tarde tenemos a la gente Portes con nosotros aquí esta tarde, dándonos más información sobre la apertura del enrolamiento para el Medicaid y Medicare. En estos momentos estamos exaltos por la sencilla razón de que el mercado está abierto para ustedes ir a chequear qué es lo que conviene, qué es lo que no conviene. Así que aquí tenemos una gente esta tarde que habla español e inglés. Así que cualquier pregunta, no tengan, eh, no tengan hesitaciones de llamarla a ella o buscarla. Ella está en Facebook también, ella hace sus lives hablando del mercado. Así que síganla, hagan cualquier pregunta. Si quieren cualquier cambio que quieren hacer en esos momentos, pueden contactarse con la agente Portes. Danos tu teléfono de nuevo.
Gracias, gracias. Así es. Mi número de teléfono es el 929-366-8578. Y como Melanie dijo, estoy a la orden. Quiero a mí, mi meta, otra vez creo que lo dije anteriormente, pero mi meta es sentarme con estas familias y checar en realidad cuál es el mejor Medicare Advantage para cada persona y entender de que no es uno solo, sino hay muchos diferentes donde podemos elegir uno que mejor le quede a su vida, de cómo a su doctor, de la red, a su especialista, de todos los otros beneficios que trae, si le conviene, que no es uno solo. Así que es muy importante si todavía saben cómo mencionó de que puede ser elegible, pero todavía no ha aplicado. También ya, denme una llamadita y bueno, vamos a empezar el proceso que bastante veces que lo he hecho y es mi placer ayudar a cada uno de ustedes que necesite mi ayuda.
Definitivamente pusimos el teléfono de la gente Portés en este podcast. Lo tenemos ahí abajo, entonces ustedes pueden llamarla. las horas que te pueden llamar, porque es muy importante.
Sí, me pueden llamar. Bueno, ahora estamos, como decimos, si no cojo el teléfono, si no lo contesto, siempre me pueden dejar un mensaje y le devuelvo en menos de 24 horas o durante 24 horas. Y me pueden llamar todo de lunes a hoy. Bueno, estamos en Annual Enrollment, so ahora es de lunes a sábado de 9 de la mañana a 6 de la tarde. De
Bueno,
9 a 6.
solo quiero decirte muchas gracias, te aprecio mucho por
Mm,
estar con nosotros esta noche y ojalá que no sea la única vez que tú vengas aquí para hablar sobre el plan. Esperamos que tú te seas también ya comadre de este programa, que puedas regresar tal vez con otros temas que pueda elevar la comunidad, especialmente la comunidad en estos momentos que está en en los negocios, porque sé que también tienes otros negocios debajo
sí.
de tus manos, pero agradezco tu tiempo que hayas tomado para venir a nuestro programa hoy.
Ay, no entiendes, no sé cómo explicarte lo feliz que estoy. Muchísimas gracias por tenerme hoy en día aquí, brindando esta información tan importante en un momento tan importante. Y para la comunidad que muchas veces, tú sabes que no hay suficiente información allá afuera. A veces no la hay y es muy importante que gente como tú y yo salimos aquí afuera, la comunidad en Facebook, que están muchas personas de nuestra comunidad conectadas, donde se puedan comunicar con nosotros y bueno, poder ayudarles. So, muchísimas gracias. Un
It is
placer y cuando quieras regreso.
my It's my honor to have you today at Orlando Conveli Lee speaking about Medicare open enrollment 2026. So shop around. We do have her here. We already have her telephone number. So what else? If you have any questions, feel free. And not only that, our program is open on Thursdays. So if you are an entrepreneur or you have a small business or you have a story that you want to share, the platform is open for you guys. This is for our community. So let's join together. We do speak three languages, Garifuna, Spanish, including English, so you would not be lost. So, Karina, I appreciate you and I wish you nothing but the best for this open enrollment and for the years to come. Thank you
Yeah.
so much.
Thank you so much. Mwah. Thank you so much. And I hope to hear from everyone here. Okay. So have a great evening and yes.
Absolutely.
AEP's here, so yes, thank you so much.
And thank you for our audience and our audience to be later on, share and like our.
Like.
Bye, guys.